Ahead and get started. Welcome, everyone. I am Annika Izagiri. I'm Communications Director with the Committee to Protect Healthcare. We are happy to have you with us today on the anniversary of Medicaid and Medicare. We are joined today by State Representative Tara Johnson, Executive Director of Citizen Action of Wisconsin, Dr. Robert Craig, and physicians across Wisconsin to discuss the need for passing a BadgerCare Public Option. This call comes as Republican attacks and inaction on Medicaid are leading more Wisconsinites to lose their health coverage. Before we begin, I'd like to note that the physicians speaking today are speaking as individuals and with the Committee to Protect Healthcare, not necessarily on behalf of any employers. So we respectfully ask that you only refer to them in any coverage as they introduce themselves, and please do not include employment information or other affiliations unless they expressly share that. So thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, Representative Tara Johnson.
Good afternoon, everyone. It's my privilege to represent the 96th Assembly District, which is Western Wisconsin. It starts on the shores of the Mississippi River, covers southern La Crosse, the city of La Crosse, La Crosse County, and all of Vernon County. So beyond the banks of the Kickapoo River in the Driftless region, about 850 square miles. And I give you that context because as we are in full swing campaign season, it's important for me to be reminded that as I'm knocking on doors, as I'm meeting constituents, this issue of access to affordable quality health care is top of mind for so many voters. It's definitely part of a constellation of affordability issues in general, but healthcare concerns are continuously what I hear at doors and as I meet constituents. And so that is reinforcing to me of the importance of the BadgerCare Public Option bill that we introduced earlier this spring. Feel very, very privileged as a freshman in the legislature to have been the lead author on a bill that had been introduced last session, the 22-24 session, by then Representative Christina Shelton. And it is a bill that when we rolled it out, we took it on the road. We were in Milwaukee and Superior, Madison, Ashland, Green Bay, Appleton, Westby here in the 96th. And everywhere we went, we heard from hundreds of voters and residents that this notion of having access to affordable quality health care is of profound concern for them. And so the bill specifically, I just want to highlight a couple of points. One, it first of all, raises the eligibility level from what is currently 113% of the federal poverty level up to 200% for individuals. And that is important because that will likely draw in somewhere between, on the low end, 50 to the high end, 75 or so thousand Wisconsinites and make them eligible to receive BadgerCare. And then secondly, it has a component that offers the opportunity for small businesses, so employers of 50 or fewer, to go into a state exchange and make available to them and their employees affordable quality health care through a BadgerCare marketplace that the state would run. Now, we know that the Trump administration with the I don't know what we're going to call it today, the big terrible bill. It has put up more roadblocks for a state like Wisconsin to be able to implement a bill like this. But it still is the case that we introduced this bill that we have almost the entire Democratic caucus in the Assembly and most in the Senate who support this legislation and are determined to overcome those hurdles that get thrown by the Trump administration and make sure that voters understand that we share their values. We want them also to have access to affordable quality health care, and that this bill is a really important step towards gaining access for tens of thousands, if not hundreds of thousands of Wisconsinites to accomplish that. It is not the end game. It is a huge next step to get us to what I hope will be universal health care in the state of Wisconsin. Would really love for that to be nationally, obviously, but this is the work that we have been doing since we introduced the bill back earlier in the spring. Hopefully that's enough context. Happy to answer questions when other speakers are done, but I think I'll leave it at that for right now.
Thank you so much, Representative Johnson. I'll introduce
Sure.
our next speaker, Dr. Dahl-Winther.
Thank you for inviting me to participate in this important discussion. I'm Dr. Kristen Dahl-Winther, and for 22 years now, I've been a Wisconsin physician board certified in family medicine. We're here on the 61st anniversary of Medicare and Medicaid, two of the most successful public health programs in our nation's history. For more than 6 decades, these programs have helped our seniors age with dignity, ensured people with disabilities can access the care they need, and given millions of children, families, and working adults the opportunity to live healthier lives. As a family physician, I've seen firsthand how Medicare and Medicaid don't just provide insurance, they provide security. I own and practice at Birchwood Family Medicine, a direct primary care clinic where 80% of our members' healthcare needs are met for 8 cents on the dollar. Yet insurance access remains vitally important for the 20% of healthcare that we cannot provide. And when that hospital and specialty level care is needed and is inaccessible, patient outcomes suffer greatly. Medicare and Medicaid allow people to get preventive care, manage chronic illnesses, afford life-saving medications, and avoid medical crises before they happen. But today, instead of celebrating these remarkable achievements, we're confronting a growing healthcare affordability crisis. Families across Wisconsin are paying more for health insurance, more for prescriptions, more for deductibles, and more every time they walk into a doctor's office. Patients increasingly tell me that they're delaying care because they simply can't afford it. They skip follow-up appointments, stretch medicines, or avoid recommended tests because the bills are just too high. Unfortunately, Congress has made that crisis worse. Just over a year ago, Wisconsin's Republican members of Congress, including my representative, Tom Tiffany, voted for H.R. 1, legislation that makes the largest cuts to Medicaid in American history in order to finance tax breaks for billionaires and large corporations. They also failed to preserve the Enhanced Affordable Care Act premium tax credits, rather, that had helped working families afford health insurance. And as those tax credits are disappearing, thousands more Wisconsinites are seeing their premiums rise dramatically or are losing coverage altogether. When people lose health insurance, they don't stop getting sick. They simply stop getting care until their conditions become more serious, more expensive, and more difficult to treat. I think of a 44-year-old woman who I take care of along with her entire family. She has 26 chronic health conditions, including an uncommon disease called renal tubular acidosis. This disease requires incredible diligence in her following a strict diet and strict medication regimen to prevent death. And when she had Medicaid prior to H.R. 1, I was able to keep her out of the hospital because she had access to the expensive medicines and the specialists that I need to work with me to care for her. Since losing it, she's been hospitalized 5 times this year alone. Then there's the 2 women also in their 40s, most certainly who have Ehlers-Danlos syndrome, a condition that causes recurrent musculoskeletal injuries and pain, along with skin and cardiac complications like aneurysms. Neither of them are able to access the physical therapy and rehabilitative care that they need. And as a result, not only do they suffer personally with pain and symptoms, but they're unable to be as productive in their careers and workplaces as they could and otherwise would be were they able to get the care that they needed. And it just doesn't have to be this way. 61 years ago, our leaders in Congress understood that. The anniversary of Medicare and Medicaid should remind us what's possible when we choose to invest in people's health instead of taking healthcare away. We can choose now to invest in people's health by passing the BadgerCare Public Option bill. Wisconsin's leaders have an opportunity and, frankly, a responsibility to build on the legacies of Medicare and Medicaid by expanding access to affordable coverage here in our state. Now I'd like to introduce Dr. Shell Hayes to speak.
Hello, I'm Ken Shellhays. I'm a family physician from the Waukesha area. I've been in practice for over 30 years, and most of the patients I've taken care of over that time have been insured by Medicaid or Medicare, and a large chunk of uninsured folks. As physicians, we spend our careers trying to help keep people healthy and treat them when they get sick. We encourage preventive care, we help patients manage their chronic illnesses, and we work every day to treat sudden illness and catch health problems before they become bigger problems and emergencies. But too often, the biggest barrier isn't a lack of effective treatments, it's whether somebody can actually afford that care in the first place. That's why it's so frustrating that year after year, Wisconsin's Republican legislative leaders have refused to expand BadgerCare, despite overwhelming evidence that expanding coverage improves health, it strengthens hospitals, and it saves lives. I care for patients who work full time, raise families, contribute to their communities, and yet they still struggle to afford health insurance. This affordability problem is now far worse after Congress and the president eliminated premium subsidies for the Affordable Care Act. I meet patients who postpone preventive screenings because they're worried about the bill. Others ration medications or avoid follow-up appointments because they simply can't make the numbers work. And still others who postpone coming in for infections or asthma or other urgent issues. By the time many finally do come in to see me, what would have been a manageable health condition has become a much more serious and more serious problem, and too often it's become either an emergency, leading to an ER visit, or leads to a hospital stay, or both. I want to be clear that access to healthcare through Medicaid can help to prevent that. Wisconsin has long been an outlier in this area, unfortunately. While most states have expanded Medicaid and broadened access to affordable health coverage, our state has repeatedly failed to act. In fact, we're just one of 10 states that actually hasn't expanded Medicaid under the Affordable Care Act. And why? It's because Republican leaders in Madison really have just refused to act. This means that too many hardworking families continue to fall through the cracks, even though solutions have been available for years. The ability for you or your loved ones to get health care should never depend on your income, your zip code, or whether your employer offers affordable insurance. In fact, every Wisconsin family deserves the peace of mind that comes with knowing that they can see a doctor when they need to see a doctor. But expanding access to affordable coverage isn't just good for patients. It strengthens rural hospitals and health systems. It reduces uncompensated care that hospitals and doctors have to write off. And it also creates healthier communities throughout Wisconsin. Today, as we recognize 61 years of the fabulous success of Medicare and Medicaid, we should also recognize that the work of expanding healthcare access in our state is not finished. Wisconsin has an opportunity to do better. It's a time for our state leaders to stop saying no to solutions and start saying yes to healthier families, stronger communities, and a healthcare system that works for everybody. It's time to pass the BadgerCare Public Option bill. Now, I'd like to introduce Dr. Crowley to speak.
Hi, everybody. Um, Thank you to the amazing speakers that have gone before me already. I'm just sitting over here nodding to everything you have to say. I'm Samantha Crowley. I'm an emergency medicine resident physician in Madison here. I grew up in the state of Wisconsin. I went to medical school here. I chose to stay here in Wisconsin to continue to help care for the people of Wisconsin. And as an emergency physician, I see patients on what is often the worst day of their lives. People come into the emergency department every single shift with heart attacks, strokes, severe infections, uncontrolled diabetes, asthma attacks, and mental health crises. And of course, while managing medical emergencies is truly an essential part of my job, so many of these complications could have been prevented if patients had been able to access the regular, affordable health care long before they got to the emergency room. Too often, patients tell me the same story. They couldn't afford health insurance. They delayed seeing their primary doctor. They skipped the medications that they're supposed to be taking because they were too expensive. They often wait until their symptoms become unbearable and they had nowhere else to turn. And even then, patients end up with devastating medical bills from their trip to the emergency room, without which that visit, they may have lost their lives. Just a few weeks ago, I was working an overnight shift in the emergency department, and we got a call from our local EMS team over the radio that they were bringing in a 24-year-old after a suicide attempt. After our initial stabilization of the patient, I went back in and I sat down to talk with him. And I asked him what led him to this point, as we're supposed to do to try to help. He told me that he has type 1 diabetes and he just received his medical bill from several weeks ago when he was hospitalized for diabetic ketoacidosis, which was a complication of him not being able to afford his insulin. Our healthcare system failed him in so many steps along the way, and it almost cost him his life twice. Emergency departments will always be here, hopefully, as long as we have the funding to do so. But they should never have become the primary source of care because our healthcare system has failed someone. Patients should not have to weigh the cost of their lives versus the costs of going to seek healthcare because they can tell something is wrong in their bodies. That's why Wisconsin has this opportunity to take this important step forward in passing this bill, SB 1121, to create the BadgerCare Public Option. This legislation would expand eligibility for BadgerCare so more lower income families can get the coverage they need. It would allow other Wisconsinites to purchase an affordable, high-quality BadgerCare Public Option plan, giving families another choice when private insurance is simply too expensive. This means more people could establish care with the wonderful primary care physicians we have in our community, some of which we've heard from already today. More patients could receive the preventative screenings, manage their chronic illnesses, fill their prescriptions, and seek treatments before these conditions become life-threatening and they have no other choice but to turn to the emergency room. Today, on the anniversary of Medicare and Medicaid, we should remember that these programs succeeded because leaders were willing to think boldly about expanding our healthcare access. Wisconsin now has the chance to continue that legacy. So far, our Republican leaders in Madison have failed us by refusing to expand Medicaid over and over and over every chance we've gotten. Our Republican leaders in Washington have only made it worse. Right now, it's time for a change. Passing SB 1121 would move our state closer to a future where affordable, high-quality healthcare is available to every Wisconsinite, not just those fortunate enough to have the right job or the right insurance. Our patients deserve that future. And as physicians, we urge Wisconsin lawmakers to make that a reality. Thank you, everyone. Now I'd like to pass it on to introduce Dr. Craig to speak.
Hi, everyone. I'm Robert Craig. I'm the Executive Director of Citizen Action of Wisconsin. And the three physicians we have on this call who just shared their experiences have just, put a really fine point on how serious a problem it is when people can't afford the care they need and how it makes their conditions much worse, causes more cost, injures them, literally, because if you handle something earlier, you can handle it in a way that protects health much better. And how this is getting worse and worse. And, the story Dr. Crawley just told about a suicide victim who can't afford their insulin. I mean, that is exactly, this is a life and death situation. And it's getting worse right now. And it's something to think about on this anniversary of Medicare and Medicaid. I mean, when they were enacted, it was a hope by the time we're 2 decades into the 21st century that we have guaranteed health care as a human right, and we're going backwards right now. And there are reports from major health systems. In fact, the New York Times has a major article today about it, that they are seeing, because of the cuts in the Affordable Care Act subsidies, and the Affordable Care Act built on Medicare and Medicaid, it was another step forward, but because of those cuts, they're seeing a large number of, much more big spike in uninsured people coming into the emergency room and or needing emergency surgery, which of course is completely uncovered, but they are legally required at least to deal with the emergency. And they're seeing a lot more patients who are not getting the care they need, are skipping surgeries or not taking their medications, etc. And more major health systems are thinking about closing facilities like birthing facilities or closing things like rural or inner city hospitals. So this is happening before the real bulk of the Medicaid cuts kick in, which is January 2027. We know it's going to be several years until there's a president and a Congress that can try to fix the mess that's been created, that's made an already costly system worse. We already had a healthcare cost crisis. This is added to it, right? So it's really incumbent on state leaders to step up. And there's a possibility of a legislature that could take real action in 2027. And so Representative Tara Johnson and all of the folks who've signed on to this bill, which I believe is close to 50 legislators between the two houses, have stepped up. But what the BadgerCare Public Option does is, and this is what state lawmakers do, they can figure out what tools they have, right? We can expand Medicaid still. That was not changed. So we can do Medicaid expansion under the ACA. We can build upon that under the ACA, a basic health plan like Minnesota does, that brings you with public coverage up to 200% of the federal poverty level, double the current Wisconsin level. That's in the bill. And in addition, you can allow individuals and small businesses to buy in, and those individuals can get the subsidies under the Affordable Care Act for more comprehensive coverage that is less expensive. And so this would be the most dramatic increase, frankly, since Medicare and Medicaid, of affordable coverage in Wisconsin, right? And the ACA itself obviously was an increase as well, but we didn't get the Medicaid expansion in Wisconsin, one of the 10 states that didn't. So this is what leadership is. If the federal government won't act, fails in its obligations, state leaders need to step up. And we're seeing right now during this election season, I know this is a nonpartisan call, but we're seeing the cost of healthcare being near the top of the list because it's one of the top affordability issues and because it's a life and death issue. So, and you've seen the stakes, the three physicians have laid it out. It is absolutely critical that we have a governor and a legislature that will take action and will start to ameliorate this crisis, because it's from the federal level, it's not getting better, it's getting worse in 2027. So thank you very much. And I know that's a tough way to memorialize the anniversary of Medicare and Medicaid, but you know what doctors and physicians do and medical professionals, they tell the truth, as hard as the truth is sometimes, because that's the first step to the cure. So thank you very much, everyone. It's been a pleasure to be on with you.
Thank you so much, Dr. Craig, Representative Johnson, and Dr. Dahl-Winther, Dr. Shellhays, and Dr. Crowley for sharing your truths and for advocating for the public option. We'll now open it up for questions. If you have a question for any or all of the speakers, there are a few ways you can go about asking that. You are welcome to just chat your question in the chat box. You can use the Q&A function through Zoom. Or if you prefer to ask your question verbally, you can raise your hand and I can allow you to unmute and ask your question. So we will allow a few moments for folks to be able to type those questions or raise their hands. Denise, I think you raised your hand if you wanted to unmute.
Hi, I own the Racine County iNews website in Racine, Wisconsin, and I actually literally just got back from my parents' house in Florida. So I got a big front row seat into a lot of the problems that you're talking about. My mom actually just passed away last week. And one of the things that I noticed was a lot of stress with regards to just like basic updates around healthcare notes, like updating things like the med list, and so that became like more of an access issue, and the falls ended up becoming more. So I'm wondering what you guys are seeing with regards to with this increase in the number of people that are coming back to the ERs and things along that line. What does that actually look like and feel like and live like from a logistical standpoint? And how, as journalists, do we best tell those stories?
I'll take a stab. I see this in two ways. Um, in my sort of my day job as a family doc, I see very much as we described in each of our sort of, our spiels, it's a lot of missed opportunities to have intervened upstream a little bit and protected somebody from having to, number one, even just come back and see me so frequently, or worse, ending up in the ER, or worse, ending up in the hospital. And, asthma is a great example of how that works, where if people have pretty ready access to a primary care doc, when their asthma starts to get a little funky, they can get in. First, they can call us and get some advice. And then they can come in in a reasonably prompt way. We can give them some treatments, alter their sort of general regimen, and most of the time get them back on track. And they don't have to land in the ER. And if they're uninsured, as somebody else brought up, that just that alone is thousands of dollars. And then if you're talking about even a brief hospital stay, that's in the tens of thousands of dollars. And most average folks don't have that kind of money sitting around. So that's my day job. I'm also a volunteer at a free clinic where I live, and we see increasing numbers of people who used to be insured and they have no other place to turn to, so they come to us. And we do have some resources to help support them, but it is nothing like being able to, order medications routinely and know that they're going to get covered, or order tests routinely and know that they're going to get done.
I'll expand on that too, if I might. Kind of to Dr. Craig's point, the system is broken. It wasn't good before these cuts, in the last, 22, no, even more than that, more than 25 years ago, I remember marching on the state capitol as a first-year medical student, predicting the downfall of American healthcare along with my colleagues, because we don't, as a system, value primary care very much. And so I think about my career. I spent 10 years at Mayo Clinic, and as a primary care doctor, I had 3,000 patients that were mine, and I saw them every 15 minutes. And that productivity was driven by my management and leaders, none of whom were physicians in large part. And that's not unique to Mayo. In a 15-minute visit, the amount of work that it requires the physician to do at night and on weekends in order to deliver care that we can look ourselves in the mirror and be proud of is remarkable. And many physicians working in this system are burning out. They're morally injured because they're just putting out fires. They're not able to sit down and take the time with patients and really dig in, find the root causes, and troubleshoot the cost problems and that kind of thing. And so I think part of it too is just the lack of attention to detail that comes from having to churn out patients every 15 minutes. And so when I think about patients that end up in the ER, again, I don't work in an ER now. It's been 5 years since I worked in traditional, what we call industrialized medicine. But a lot of safety issues, come back to exactly what you talked about. Med lists not being updated, medication misadventures, if you will, are the number one cause of medical harm in this country. And when I was at Mayo Clinic, I spent 5 years as a patient safety officer for the entire Mayo Clinic health system, and did a patient safety executive development course at the IHI out east. And it really comes down to paying attention to detail, feeling safe to speak up, communicating clearly, all of those things that require time, more than 15 minutes per visit. So that's definitely a factor as well.
15 minutes for a primary care appointment is just, you can barely get a couple of sentences in, let alone dive into what's actually going on with the patient. And I do feel like that is one of the harms I really see in the emergency department is when people come to the emergency department for these more primary care like issues, when there's 50 people in the waiting room, they've been sitting there for 8 hours already. We have like 5 different people in septic shock in rooms 2, 3, 4, and a trauma coming in. Like, I don't have time to give that patient the care and the knowledge and really like dive in either. The emergency department is unfortunately not at all set up for that. And it really does everybody a disservice when I can only give like half of my best effort because I'm getting paged or called to the next room, and it really does not benefit anybody if we do it that way. And it costs like 10 times more for a patient to step into the ER because they have no other option. And so it's really doing a disservice to everybody involved. Um, and of course, I know we're all on this call because we agree and we're trying to make things better. So I'm really inspired by that.
Thank you all. And I know we have a question from Eric, but I also know Representative Johnson has to hop off in a second. But I had a question chatted to me, so I wanted to give it to you if you have a minute before you go. Rep. Johnson, given that efforts to expand coverage in the state have failed multiple times under Republican leadership of the legislature, why do you think now is the time to call for this public option legislation?
Elections in November. I mean, it seems like a very oversimplified answer, but I, I spent 20 years in local government as a county board supervisor and chair of the county board. And this is my first term in the state legislature. But again, as I said in my opening comments, this issue is so critically important to folks. And I think that elections do matter. And I think that this topic is so important to so many Wisconsinites that they will be voting their health. They will be voting their lives. They will be voting their pocketbooks when, in November as it relates to healthcare and its affordability in this state. And I mean, I think we should be talking about this all the time, but I think the reason that this is the moment is because of the times that we live in and the profound impact that inaction and dereliction of duty has been having on the lives of Wisconsinites.
Thank you. And if you have to hop off, please feel free.
Yeah,
Thank you
thanks
for
so
joining
much.
us.
Thanks, everybody. So inspired by you. I appreciate you very much.
Thank you. And then we'll go back to the question from Eric with Wisconsin Examiner for Dr. Dahl-Winther. You told a patient story about a woman losing Medicaid. Can you clarify how or why the woman you mentioned lost her Medicaid coverage, if you know that?
Yeah, that's a great question. Honestly, as a physician, I don't pay attention to the timelines around what bills start and when the cut for this and that happen. All I know is that she's always worked. She has her family. The kids have grown, and so maybe that changes eligibility now that there's only one under the age of 18. But nothing has changed. They're in the same house that they rent. And all of a sudden, about a year ago, she just lost her coverage. They didn't re-up her. And she's not unique. I have a number of patients who found out that they no longer had forward health about a year ago. And so it's very challenging. She is actually pursuing disability, and medically, she absolutely is disabled. But I might argue that if she had good coverage, she might not be disabled, because a lot of these things are treatable. So it's interesting. She just had a meeting not too long ago with Forward Health, and because she was like 120% of the, or whatever, she was like less than 5% away from the cutoff somehow, thanks to her husband's income that's needed to pay the rent and feed the family and all of those other things. She doesn't even drive. She drives her UTV to my office to see me. And so there's nothing other than her family making a little too much. And so they have the choice, do we cut our income and not be able to afford our food and our rent just so we can qualify for forward health? They can't do that. And so she's out. And so this bill would specifically help this family because she would be within the 200% cutoff that it offers, that is so much more reasonable for care.
Thank you, and thank you for that question, Eric. I had another question chatted to me, I believe for any of you. He is your congressman right now, Dr. Dahlwinther, but he's also running for governor. Congressman Tom Tiffany called his vote for HR 1 a major win. How do you react to that? Again, that's for any or all of you.
Well, I'll just speak because I've spoken before about my feelings about Tom Tiffany and the decisions that he makes, and it's clear he does not care about the people that he allegedly serves. He cares about the big businesses. He cares about the billionaires. He cares about being backed by our president. And I don't know. I can't speak to why that man makes the decisions that he does. I think that in our current system, from the perspective of a Republican congressman, if it pleases if it pleases the president, it's a major win. They are not focused on the people that they are supposed to serve. And it's for that reason that I would spend any free time that I have actively working against his campaign. If he becomes our governor, we will not have this bill. We will not have the leadership that we need to really make change in Wisconsin, just like we didn't when Scott Walker, I believe, was the one to decline expanding Medicaid access across the state. And so we need people in power that care about the people in this state. We must take care of each other. There is no other option.
Let me add a little bit to what the doctor just laid out. The doctor's right. You can't get into the heart of someone and determine their actual motivation. It could just be about power. But I think that there is a fundamental assumption that people who don't have health care, it's their fault. That somehow if they worked harder, they're more responsible, that they'd have health care. And it refuses to take into account the incredible cost of health care in this country, which is, I mean, the prices of the major health systems in Wisconsin, they negotiate with insurance companies, are 325% of the rate what Medicare pays, and Medicare is higher than the peer average of all the advanced industrial countries for inpatient, outpatient care. So no one, unless you're actually rich, can afford this on their own. And it is a system, if you look at the economy and the jobs available, it is just not affordable for people, even with insurance. And that's why so many people with insurance pay a tremendous amount in their premiums, either directly or it comes out of their salary because their employer pays. And then they're still afraid to use it because of the co-pays, deductible surprise medical bills. So I see Dr. Shellhays has a comment on this too. So I'll hand it over.
I just wanted to add that the majority of people who have Medicaid have jobs. And that has been true for as long as Medicaid has been around. And there's this misconception that, oh, they're not working or working hard enough. Most of them just have jobs that don't offer health insurance and don't pay multiple six figures, so they can't afford to go buy insurance on the open marketplace at, some insane premium cost. So, and that's certainly true of the people that I've taken care of through these 3+ decades that I've been doing this. They have jobs, they just have crappy jobs that don't give them benefits.
Thank you all. I am not seeing any other questions. I will mention before we wrap up that we've been recording this, so if you'd like a copy of the recording, please you can chat me in the next 30 seconds or so, or send an email where you RSVP'd and I can get you that later this afternoon. But I want to again thank everyone for joining. We really appreciate you being here. And thank you so much to our speakers, Representative Johnson, Dr. Craig, Dr. Shellhays, Dr. Dahl-Winther, and Dr. Crowley. We appreciate your time and your advocacy on this Medicaid anniversary. Thank you so much. Have a good
Thank
day.
you.
Thank you.